We are joined with Dr. Abdullatif Saad Alokifi from the Ministry of Health in Saudi Arabia. Dr. Abdullatif, can you provide a brief overview of your professional journey and how you came in your current role as Assistant Director for Hospital Affairs and Chairman of the Hospital Commissioning Unit?
Thank you so much. I started my career as a pharmacist. Then from that, I was going up with different positions. I worked in almost different organizations, government, private, hospitals, and with the agencies, some of the governmental aspects. This is cannot be coming only by your work. You need to develop yourself. You need to have some of the skills to be built up on. You need to meet people, gathering similar to what we are in today. And this will be building up your personality. At the end of the day, you will reach up having full of knowledge. That knowledge will be helping you to reach to whatever will be a position. The most important thing that I'm happy with align with our conference today is commissioning. The commissioning, I built up the commissioning of Ministry of Health starting in 2018.
Okay.
For along with the last 6 years having good infrastructure system, we were able to operate many hospitals within Ministry of Health. And
And what are the biggest challenges when you're commissioning new hospitals? And how do you address them?
The most important challenge is the people themselves.
Yeah.
The ability, compatibility, also their competence. How to overcome, we usually use the old hospital with a new commissioned hospital and let the people learn from each other. You need to have one person with a shadow person, like one CEO, shadow CEO, one medical director, one shadow medical director. Will be building up the knowledge within 1 to 2 months until they will fly and go ahead. This is one of the challenges. The other challenge, which is very important, the planning of the operation. When you put commissioning and the planning, don't think that the plan will be implemented as is. No, things will be difficult. So we need to have some of the ability to be
train the plans. And how does innovation in technology play a role in this planning and strategizing the whole things?
If you will ask me this question 6 years back, I will not have an answer. Today, we are having many systems, many of the ideas of having the technology. Technology will ease the mission of commission, will give us direction. Is the hospital ready to be operated or not? And for the operation, whether the hospital will be operated, is it giving and fulfill the requirement or not? The technology is very important. What do we need? No. Now we need to embed the technology with the mind of healthcare worker. Because the healthcare worker not yet getting more about
into the technology part of it. And how is the telemedicine? We see telemedicine post-COVID has really taken a big role. So how do you see telemedicine being integrated in the healthcare system, especially in the remote areas?
And my advice today, whenever we are having a new infrastructure hospital, you need to put the technology in there and the virtualization, because the virtual care is very efficient, very important. We are having many success stories in the rural areas. Areas close main hospital, they need 3 to 4 hours. By virtual care, it's in the same time.
Absolutely, yes. And what metrics are you using to measure the efficiency of these patient outcomes and this hospital performance?
We are putting things together from medical point of view, we are engineering point of view, IT, and also the customer needs. Building all together in a matrix and put it like what we need to have good services with a good commissioning plan, and will be coming up having a good practices and giving the patient the healthcare service.
We were talking about the workforce being trained, which is one of the biggest challenges which everyone is facing. So what strategies are you placing to ensure the healthcare professionals are adequately trained and equipped to meet the current demands?
Before, we were thinking about having plenty of training. Currently, no. You need to have distinguished training. So you need to do training need assessment. You need to assess the situation. What type of training? Not every training will fulfill the requirements. So we need to select the training and we need to have a plan. Most of the training, the plan is developed but not implemented accurately. This is what we need. We need the leaders to insist on having that training plan being implemented and measured. So after the planning, training, we need to having the impact, and the impact will be measured by.
Can you share some of the lessons, what you have learned from your collaboration with international partners, and how has that completely transformed the Saudi healthcare?
Well, this is very important because with the transformation, we are getting the people together. It's a big transformation along the whole world. We have many collaboration with many entities to help us in how things will be done. We learn from different places. One of the important things is the capability of the people. If you will go back, people will not be capable to be having this transformation. Currently, we are having capabilities of the facility itself, learning of the patient being in there. We were not focusing on how the patients will be involved. Now, the patient as a customer is involved. This is one of the impact of collaboration with other entities.
What are your long-term goals for the Ministry of Health, Hospital Affairs and Hospital Commissioning Unit? How do you see them aligning with the Saudi Vision 2030?
It's one of the mandatory needs because by transformation, the role of Minister of Health will be regulator. So the regulator will give allowance for the hospitals to be operated. So without having that, let's say, certificate, that agreement, that approval, the hospital will not be operated. And this will give a good chance for the hospital to be having good services before starting operating. And one of the important things that we enroll in the commissioning accreditation. So whenever you are commissioned, that we are sure at quite time that you will get accredited.
You will get accredited. And how is it whole aligning with the Saudi Vision 2030?
This is aligned to it's one of the accessibility of the healthcare. And this is one of the goals
for the Saudi
Vision. General accessibility of the patients coming down for the Ministry of Health, and this is implemented to all hospitals.
So we really appreciate. Thank you very much for talking to MediWorld Middle East. Thank you so much.